Hello, everyone, and welcome to the Art of Collaborative Documentation. Thank you for joining. I'm Yvette Kelly with the Community and Managed Care Technical Assistance Centers, and I will be your presenter. Today's presentation will review the importance of documentation in the fields of behavioral health, explore collaborative documentation as a practice that supports improved engagement in person-centered care, and lastly, detail implementation strategies. We're going to begin today's presentation by orienting everyone to some general principles as it relates to documentation in the fields of behavioral health. None of these principles are new, but it does set the stage for why we want to talk about collaborative documentation as a practice. As a helping professional, part of the role and responsibilities in providing quality services includes properly documenting in the record. And because a record must and should be ready for inspection at any time, it is important that providers develop good documentation habits early. There are several expectations around documentation that are inherent in the role as a helping professional. These expectations include maintaining high-quality documentation related to the services the agency is contracted to and subsequently provides, understanding that the cost of documenting in the record is generally included in the administrative costs and reflected in the rate, being responsible for the upkeep of the record while noting how the individual and the family have contributed to its content, and being efficient in these tasks. And the way to be efficient is to have a solid understanding of what and how to document. One thing that needs to be continually stressed is how important documentation is to this work. As providers, we need to learn to value documentation as a representation of the therapeutic process it represents, and not just something that is seen as an unrelated mundane task. When providers value this process, they understand that high-quality documentation is essential, being a vehicle by which providers communicate, acting as a repository for where the individuals' and families' needs, services, and progress is recorded, providing the basis for reimbursement, and overall substantiating all of the hard work done by providers. In order for documentation to serve the purposes just noted, providers need to be aware of and understand some key concepts associated with high-quality documentation, and one of those concepts is that of the golden thread. The golden thread is a concept that weaves together all of the critical information and provides a comprehensive view of the individual. The reader should see the logical connection between each piece of documentation, culminating with billing and reporting. This is how the golden thread concept gets codified in the record. Medical necessity is another key concept. In short, this concept states that healthcare services rendered must be necessary to treat qualified conditions that impair an individual's functioning. This standard is what is utilized in healthcare to authorize and pay providers for services delivered. To that end, if the documentation does not detail medical necessity, then the service is not authorized and thus not billable. Both the golden thread and medical necessity are concepts that get captured in the utilization management process, a process that determines the appropriateness of service provision. It's important to note that organizations will be subject to UM reviews throughout the life cycle of an individual's care. So why make a change to our documentation practices? Why should providers consider changing these habits? As you think about the expectations and the key conceptual pieces that should be inherent in your documentation practices, how do you feel you measure up? Recognizing the importance of documentation is one thing, but developing effective documentation practices is another. This has proven to be an ongoing struggle for the field, leaving agencies vulnerable to a number of financial and practice risks. So as professionals, we need to reflect on the following three questions. How accurate is the record if the required documentation is not completed as close to the event as possible? How available is the record if the information in the record is not current and up to date? And how reflective is the record if the required documentation is not completed with the participant's input? Providers then need to consider whether their documentation habits or the documentation habits of those they supervise may or may not support quality service provision. So here are some examples of challenges related to documentation as identified by providers. The providers identify that they see documentation as a chore, that it competes with time spent providing services. They find that the paperwork is really divorced from the service provision, and that providers are using no-shows to complete paperwork and catch up, or they are completing paperwork outside of their work hours. And because there's such a high documentation to direct service ratio, service capacity is negatively impacted. One way to think about remedying these concerns is to transition to the practice of collaborative documentation. So let's go back to some of those key concepts we spoke about earlier to remind us of how quality documentation supports service provision on many levels. So it helps us ensure that the services providers are billing for are justified, that the level of care, intensity, duration of services is supported by what has been identified in the documentation, and that we are meeting regulatory standards. Providers also need to consider the impact to the overall service provision. So again, if we go back and think about a couple of those documentation challenges that were noted, such as providers using no-shows to complete paperwork and catch up, or completing the required paperwork outside of work hours, and we can talk about the impact working this way has on providers, and how this way of working often leads to staff feeling overwhelmed. And as long as providers are feeling overworked and overwhelmed, then they can't be their best self for the individual and may not be as effective in their practice. So next we'll spend a few minutes talking about the practice of collaborative documentation. Collaborative documentation is a practice where the provider and participant document together during the session. It is a continuum of practice, meaning one gradually phases in elements of the practice, and as the provider becomes more comfortable, they expand its use. The more a provider works to develop the practice, the easier it gets over time. And the practice does not replace the need for providers to hone their engagement skills, but when utilized together, can have a powerful impact on participant engagement and outcomes. Just a note about collaborative documentation versus concurrent documentation, as the terms are often used interchangeably. Collaborative documentation speaks to the importance of partnering with the individual or family, soliciting their input, documenting their input, and discussing this input with the individual or family throughout their care, but that this is done in real time or concurrently. Concurrent documentation really only speaks to the timeliness aspect, but does not reflect the collaborative nature of the practice. So, for example, completing a note at the end of a session while the individual is in the room but is not participating in the development of the note really only speaks again to the timeliness of getting that note done, but definitely not the collaborative nature. So collaborative documentation is a practice that is efficient, it's engaging, it's person-centered, it's goal-focused, and compliant. And these are all great reasons why providers and organizations alike should consider adopting this practice. And as with any new practice, there are a number of concerns that come to the surface that providers note, and here are a few of those concerns that have been noted. And we'll keep these concerns in our mind as we talk through some of the benefits of the practice. So some providers say that it takes away from treatment, that they don't understand how they can complete either a note, a treatment plan, or assessment with the client, that some feel that there are no clinical benefits to completing this documentation with the client, and then some people just believe that they need to think about what they write before they complete the note. So we'll keep those concerns in mind as we walk through the benefits. So the benefits of this practice can be felt by participants, providers, and organizations alike, and we'll talk about what the benefits are to each. So for participants, engagement and retention improves as participants feel more involved. So obviously, if they are more engaged, they're more likely to benefit from the service overall. Their trust level increases as they have a shared role and an active voice in their decision making, and then they're much more motivated to do the hard work that they need to do to really improve the quality of their lives. That's very important. It also allows the participant the opportunity to offer timely feedback and supports open and honest communication. It allows misunderstandings to be more easily resolved, which we all know can erode the relationship if those things are not addressed properly. And it provides a unified focus on goals and improves client satisfaction overall. In terms of providers, it really allows providers to gain back valuable time to focus on what they're trained to do. If you remember, one of their complaints or concerns was that it really does, take up a lot of time to get the paperwork done. And so, again, allowing them to engage in the practice of collaborative documentation really does help them manage their time better and takes away that need to do the paperwork later versus when you're doing it with the client. So it does help to achieve a better work-life balance. It improves documentation timeliness and is more reflective of what occurs during the sessions. And other providers will have the benefit of your documentation when they need it. So they won't have to wait until you complete that note, but it will be done in the moment. And again, it really just protects from risk management issues and improves not just client satisfaction, but provider satisfaction as well. Benefits for the organizations include the recognition of providing high-quality services, increased financial sustainability and improved cash flow, increased capacity, and improved, again, the agency will get the benefit of having both improved participant and provider satisfaction. And collaborative documentation also has a place in a value-based environment. And so we've noted some of the benefits here in the previous slides, but this is just aligned to the quadruple aim. And so collectively, all these things lead to improved efficiencies, which leads to lower costs without compromising the quality of care. And actually, I'd beg to say that it actually improves the quality of care. So now we'll take a few minutes to talk about collaborative documentation in practice. So what does it take for agencies and programs to implement collaborative documentation? So let's spend some time just talking about how to put this concept into practice. So this practice does require a shift in thinking and will challenge providers to communicate differently with participants. First and foremost, providers will need to believe in the practice and see it as an essential element of the therapeutic process. Providers will then need to be able to describe the importance of this practice to participants, relaying it as a valuable interactive process. Providers will also need to be willing to leave some of that technical jargon and judgmental language behind. And so whenever possible, person-centered language and the use of the individual's own words should be used. Providers should look to set a routine so that it becomes a habit, and they can be prepared to dedicate anywhere from 6 to 8 weeks to try this out. Providers will need to remember to document objectively by only recording the facts and, again, leaving that judgmental language behind. And in developing this practice, you don't abandon your natural interaction style. You just incorporate more collaboration with your participants. You will not always agree with participants, but remember it's okay to disagree. So your disagreement does not mean, however, that you don't document the participant's perspective. You allow the individual to ask questions You have to be open to that. It's a great opportunity for psychoeducation, so you can assist the participant in understanding the information that is noted in their chart, what that means for them. That's helpful. And you also want to make sure that you ask clarifying questions to make sure that you've captured the information correctly. If you remember, a couple of slides back talked about how the opportunity in doing this practice really allows you to check in with the individual and to clear up any misunderstandings really right then. And so it's helpful to make sure that you're asking questions to clarify their view so that you can note it in the record. So just to reiterate, to be considered collaborative, the individual should know what is being documented, ideally by looking at it, right? Either on your screen or on paper, but they should be able to see it. They should have the opportunity to ask questions about what's being documented, have the opportunity to disagree and have their perspective documented, and also have the ability to correct factual errors. Those are some of the things that when we talk about the practice of doing this collaboratively that we're speaking of. Collaborative documentation is also appropriate for use in all of the following situations. And although when beginning this practice, providers find it easier to begin with progress notes, but it is effective for use in documenting assessments, service or treatment plans, and discharge notes as well. So here are some of the considerations for setting up collaborative documentation. So you obviously will have to think about the technology that is needed to support implementation, and you'll need to problem solve around any connectivity issues. You will need to identify the training needs for staff, like what do they need to know as they roll out this practice. Perhaps they will need to gain an understanding of the benefits so that they can relay it to their participants. They will need to kind of consider what their office setup is like. So do computers or furniture need to be rearranged so that the individuals can engage in this process? They will need to identify expectations around the use of collaborative documentation. When are you going to use it? How are you going to implement it? What are you going to do first? What are you going to do second? And then you also need to develop scripts for providers so they know how they are going to introduce the concept to participants and that they do this in some structured way. When we're talking about engaging in collaborative documentation in a telehealth environment, there's some additional considerations, and one of them is, the first thing is that folks need to be knowledgeable of the agency's confidential and telehealth procedures before rolling this out. You need to confirm with the participant that they have an internet connection and are able to access that. So that will be important, and that will be important as you bring them in to kind of view the note in the screen or the assessment, whatever documentation that you're working on. You will need to confirm with the participant that they have a suitable and private space to meet, so that, if you are sharing documentation, that it's not shared more broadly than what is expected. And you would provide your welcome as you normally do, and then you would, again, bring up the we're going to say progress note and share that on the screen. And so this will help you complete that note with the individual in session. And then you should always have a backup plan in case your technology fails. So, if while you're meeting with them, you lose connectivity or they lose connectivity, what is going to be the next step? These same considerations apply when practicing collaborative documentation in the community, but special attention should be given to the technology needs as well. So again, will providers be able to connect while they're out in the field? If not, what is going to be the backup plan? Do providers have connectivity to an AHR system that allows for syncing later? If not, what's going to be the next best option? And so there's also this added concern around securing records when out in the community. So You need to consider how this is going to be done, and then how staff will get timely access to pertinent information is going to be all of the things that you need to consider when rolling this practice out for folks who are working in the community. So whether meeting participants in the office or community, you always need to ensure that you're paying mind to the information that is being shared and that others who should not have access to viewing that information is not. And so you'll need to consider your HIPAA compliance and kind of how that gets overlaid on top of the work that you're doing in the field and connecting with participants and working collaboratively with them. You want to just ensure that others are not able to view protected health information. And then also, as providers begin to implement this practice, it will be important for these skills to be strengthened during supervision. So this will be something that as providers roll out, they will definitely need some direction and some supervision around what practices might work best for them. So here, when we're talking about developing a script, here are some script elements that you should consider including, and these elements are just there to help you think through how you can relay this information to participants and how to gain buy-in to the process. You want to highlight that their feedback and opinions are important, that you want to make sure you capture their feedback correctly. You want to also, explain that you'd like to ensure that you're providing them with the best service. And remember that this will be novel to most participants, and you may need to provide guidance as to how they can participate. This might be a little bit new for them. They may not be used to offering their feedback, and so you just need to really encourage them to do so. Here's an example of a sample script, particularly when working with new participants. So it goes, here at, let's say, the Get Well agency, we believe that there's value in making sure that you contribute to what is written in your record about our sessions with you. Also, I want to be sure that what I write is correct and that we both understand what is important about our sessions. So at the end of the session, we'll work together to write a summary of the important things we discussed. And again, this is just a sample script, but it does give you some of that language if you are thinking, like, how do you relay this to participants? And again, here is another sample script really for existing patients where this will be a new practice. It's similar to the first one, but it does take into consideration that you're changing the practice on them. So again, I encourage everyone, if you're going to roll this practice out, to sit down and develop your script. Here are some actual phrases that can be helpful to providers as this new practice gets implemented. Again, in talking with your participants, I'd like to get your feedback on our session today. Let's sum up what we did. Let's stop here and review what we've talked about. And so all of these can be helpful as you begin to, again, roll out and implement this practice. For those of you who work with children and question whether or not collaborative documentation can be utilized with this population, here are some techniques for introducing this concept to children. So you really just want to encourage them to, they could tell a story about today's session. If an adult is available who's perhaps maybe waiting out in the waiting room and you bring them in, you can ask them, hey, can you tell your parent, your guardian what you did today? If no adult is available, if it's an older teen and they come to the sessions by themselves but will be going home, you can ask them, hey, when you see your parent or caregiver, what will you tell him or her about our time today? And then there's also a whole lot of different strategies that you can use to really just support kids in being able to participate in collaborative documentation. So you can do, simple rewards or an activity bag, something that they can do while they are completing the note. And these activities really should be reserved for when they're doing the wrap-up. And so, again, it's part of building that routine, and they become accustomed to it. And then, explain, depending on the age of the child, if you just explain the need for their help with you needing to complete your homework, and that you want to really help them understand what you need and how their input will be helpful to you. In terms of just for starting, I think the key here is just to, find a starting point. Um, you know, as I mentioned, collaborative documentation can be utilized with all types of documentation, but the easiest starting point is usually with progress notes. So pick at least one section of the progress note that you can complete with the participant, and then start using that section as a starting point for the following session, and then increase the amount that you do over time. Again, like I said, it's easier done as the more that you practice it. And then just remember that these are really documents are really clinical tools that should be utilized and not forgotten. So there's a lot of benefits to doing collaborative documentation, and one of the greatest benefits is that you really do begin to work a little bit differently with participants, and you really begin to adequately capture their feedback and kind of what they're feeling, and so it does open up that dialogue. So just to remember that. Again, this will challenge you to, change how you're writing in some instances. For some of you, it will. For some of you, it won't. But, just to remember to use descriptive language of what was discussed. Focus on behaviors rather than like clinical labels or judgments. You always want to highlight participant strengths. And you can use, note writing prompts for easy discussion. But I think in part, you just want to make sure that you're capturing their feedback correctly in a way that doesn't offend them. And again, you factually will capture some of the pieces of the record. And again, you may not always, the participant may not always agree with you, but or you may not always agree with them. But being able to identify that in the record is important. So here's just a sample of how you can, how collaborative documentation is implemented in session. Again, it's usually, if we look at this chart here, this is a 45-minute session, and if you see the last 10 minutes is kind of where the collaborative documentation will happen. And so, you do your intro and you do your interventions, and then during that wrap-up period, you can do collaborative documentation. And so just a few notes about this practice. So there are times when engaging in the collaborative documentation process is not appropriate. However, that is generally only about 7% of the time. And about 93% of the time, concurrent documentation is appropriate, positive, and helpful. So I encourage you to spend your efforts focusing on the 93% of the time in which this practice can be utilized. And as always, you will need to utilize your clinical judgment to determine when this practice is or is not appropriate. And as a wrap-up, I will leave you with the following tips. So you want to give yourself a goal. So how many of your clients will you use this with, and what time frame? What percentage of the note will be collaborative? You want to plan again for the areas that you will document together. You want to develop and practice your script. That's going to be important. Remember, you're going to have some existing clients and some new clients, so you want to plan for that. You want to identify and explore areas of resistance and reasons behind that resistance. So either from a supervisory standpoint, if a provider is resistant, you want to talk with them and explore that. And then from a provider standpoint, if a participant is resistant, you would definitely want to explore kind of what are the reasons behind that. You want to allow access for the participant to be able to see the document or the note. And you really want to use the documentation to empower the client interaction. Again, like I said, there's lots of benefits to collaborative documentation, and you want to really harness the power in that. So there are a number of resources that you can look through that walks you again through some other elements of collaborative documentation. So hopefully you will find that helpful. And that brings us to the end of today's presentation. I do hope that you found the information helpful and informative, and I hope that you will consider adopting the practice of collaborative documentation. So thank you for joining again, and have a great rest of your day.